Okay, we might get going. Still quite a few people coming online. Thanks everyone for joining. It's really great to see so many people on this call. We're up over 100 now, which is getting close to a Cardno record, or at least for any video call that I've been on. So for those of you who don't know me, my name's Mark Pruden. I'm the knowledge lead for Cardno's Asia Pacific team. Quite a lot of unfamiliar names and faces on this call, at least to me, but that's great. That's certainly part of the reason for starting these project sharing sessions. We're really keen to find new and better ways to bring staff together, both project staff as well as between project and corporate staff, to better understand what other parts of the business are doing, how we can better share ideas, lessons, resources across our portfolio to help us improve our work. So, these monthly sharing sessions are just one of a number of initiatives that we've got planned to connect people and share information across our business. So expect to hear more on this soon. We thought we'd start off by showcasing the work of 4 of our projects. Perhaps not very imaginative, choosing COVID responses as the first topic, but it's obviously been, the major common challenge we've all faced over the past 12 months that's affected all of our projects in very significant ways. We're very proud of how all of our projects have responded and delivered under those circumstances, and we think we're probably overdue in taking the time to reflect on some of these experiences. So, but yeah, I'm sure projects would also welcome the opportunity to talk about something other than COVID. So I promise that we'll tackle different topics through future sessions. We deliberately selected a pretty diverse group of projects to present today. Different sizes, sectors, geographies, even clients. We've got one non-DFAT project amongst the 4 today. So hopefully that will translate into a diversity of experiences presented today. We're always obviously very keen to hear about good news stories, but we also don't want to shy away from discussing some of the challenges the projects have faced over the past 12 months. So I'm sure we'll hear about both sides today from the presenters. We'll have time in between the presentations for Q&A. I'd really encourage people to take the opportunity to ask any questions, to share any relevant experiences from your own projects. I know such a big group doesn't really encourage open discussion, but please, be brave. You're in a safe place, and of course there are no silly questions. So with that, we'll move straight into the presentations. First cab off the rank today is the Australia-Indonesia Partnership for Justice, Phase 2. So I'll hand over to the long-standing team leader of that program, Craig Ewers, to introduce the project and his team. Thanks, Craig.
Thanks, Mark. I'll just share just a brief presentation. Let's get it up. Just checking that that's coming up on the screen. Is that sharing now?
Not yet.
No, okay. Never mind. What I'll do is I'll talk to it, I think, rather than show it up. Yeah, okay. For ARPJ, we'd just before COVID, we'd reassessed our priorities and adopted a series of strategies, and we'd really just started them when COVID hit in sort of February, March of last year. And so we really had to look at, could they continue or did they need to be adapted? And Cardno's sort of framework that they provided for reassessing activities was really helpful and enabled us to sort of look at activities and and I suppose, to use the word that's probably been overused, pivot them to be more online. So 85% of our activities were adapted or added, 15% were discontinued, and the strategies remain relevant. In some cases, ARPJ was in an advantageous position for two reasons. One, that we'd sort of had long-standing relationships with our counterparts, and as a result, we were able to move to online communication a bit more easily than if they were new relationships or if we were setting up a new program. And I really feel for the programs that we're really, trying to mobilise during this period, because I think that face-to-face communication is important when you're setting up programs. But in ours, that sort of had already been established, so we're able to switch to online communication fairly easily. We were also mainly focused on policy change work, so a lot of policy drafting and policy advocacy, which again could be adapted to online. Obviously there were some teething problems with using the online platforms. Zoom became our sort of platform of choice, I suppose, and that took a little while to iron out problems. But we've had some really significant seminars with that, and the reach of Zoom is much higher than we had for our sort of offline seminars and workshops before. So just in terms of effectiveness, we sort of assessed that out of the 80 activities that were completed, out of the 80 activities, 61 were completed or on track, and that was about the same percentage as the year before. So in terms of effectiveness, there wasn't, COVID didn't make us less effective. And the efficiency was a similar sort of, probably in some cases, the savings of travel, we were able to reinvest in partner activities and, keep partners active and doing good work. A number of key policy targets were achieved in 2020 in the government of Indonesia, including National Strategy for Prevention of Child Marriage, implementing regulations for disability law, regulations for commercial and competition cases, expansion of electronic court processes, and a number of online knowledge hubs, which are in the process of being implemented now. There's been a number of team management issues which are probably shared amongst different projects. ARPJ is a little bit different. We're almost all local. Even the expats, Pete and myself, are fairly local. And we've been here throughout the COVID pandemic. We had to focus early on the management of risk, and particularly the management of fear among the team. And we've done that through collecting information on trends in transmission, by monitoring data, and just by keeping communication going. Like all of you, we probably provided direct support for work from home, and we're intensifying that support now as things get worse here. We've looked at sort of creating networks within networks, particularly supporting different personalities who have reacted to the pandemic in sort of unpredictable ways, but really trying to tailor our management to different personalities and the different needs of the team. We're facing obviously challenges now in this sort of new surge of transmission. People are having to care for family more, and they're getting sick themselves. So that's put more pressure on the team than we've actually faced before. We've also sort of mobilised ARPJ2 development funds, which is funded through performance bonus payments, and we're going to look at using some of that to help team members recover through this as well. So that traditionally has been used for development opportunities, and they've continued online during COVID, but we're also going to expand that to sort of direct expenses associated with recovery. So that's pretty much it from our side. I'd certainly be more than happy to answer any questions. Thanks.
Thanks, Craig. A quick question from me, and just give you a chance to blow your own trumpet. But I understand that ARPJ won an award in terms of its response to COVID in one or more activities. Is that right? Australian Government Award?
We've had a significant policy change sort of acknowledged for the work we did with guidelines for prisons. So I mean that ARPJ has been recognised within DFAT for the pivot, but I think the main direct recognition is probably for the work in the prisons in helping establish guidelines for the prisons and sort of implementing the training that associated with that guideline. So to an extent, that's helped prevent transmission in the prisons. But yeah, we're a little bit nervous about crowing about that too early at the moment, because we might see a big increase in transmission in prisons in the next few weeks.
Right. Okay. All right. I'll open it up to any questions from the group. Joe, always with your hand up first.
Yes. Thanks, Craig. I guess like a lot of your focus has obviously been around your team and supporting your team through all of the challenges that you're all personally facing, and obviously that's critical to ensuring ongoing program effectiveness. And you mentioned the approach you've taken to helping manage fears in the team, and a lot of that's been around helping share information and so on. I was wondering if you could expand on that a bit, on what kinds of approaches you've used there.
Yeah, I think a lot of it's sort of personal communication, because different people view this differently. And I mean, fear helps protect us, of course, but it can also, you know, limit us as well. And we still wanted to keep going with our work and with our lives, really. The risk levels in Jakarta have gone up and down over this period. So we've been monitoring that through the official data, which is all we can really do. But we haven't trusted the official data absolutely. We've mainly been interpreting the trend. So, you know, is risk going up or is risk going down? And we started doing that weekly, and then we switched to monthly because it was getting too hard. But we're back to weekly again now, just because the risk has gone up again. By having that information, it just makes us a little bit more certain of what risk there is for us, you know, out there. So at different times when the risk was lower, our team did sort of go out more and participate in activities outside, connect again with people a little bit more. But obviously the risk is higher now, so they're, you know, coming back inside again. And yeah, so really,
Craig, I think you've just muted.
I think you've just gone on to mute.
I've gone on to mute. Yeah. I suppose, yeah, what to react to in terms of what the data's telling us, and then obviously how to manage, you know, that broader fear that people have.
Great, thanks, Craig.
A familiar name and face for you, Craig. Kerry Amos. Not sure if you should be nervous with the inside information she has on the Indonesia programs.
No, my inside information is a bit old there, Mark. Okay. I was just wondering, Craig, and I was just distracted a moment while Joanne was asking her question, Jo was. But, you know, I know a lot of what ARPJ does is based on relationships and trust with your CSO partners. So I just wondered, whilst it was online, whether you had to take some alternative approaches to ensure that that relationship base was maintained and the trust base was maintained. Thanks.
Yeah, thanks, Kerry. I think, I mean, a lot of people in our networks were fairly comfortable already with online communication. It's mainly been through WhatsApp for the last few years, but now it's obviously moving to more, video-based communication. So they're sort of used to communicating online, and that sort of continued. When the risk of face-to-face contact was reduced for a while, we did make an effort to reconnect with them, face-to-face. And now, of course, we're not again. But yeah, I think the relationships do need to be sustained with some sort of direct contact as well at some point.
Okay. One last question from me, Craig. I know, like a number of Cardno programs, AIPJ uses Australian government officials as one modality of assistance, specifically the courts in Australian courts. In your case, I was just wondering, has your ability to use and engage with the courts been? How has it been affected, say, relative to use of other international advisors? Has it been harder, easier, better? Do you think it'll change in the future?
Really good question, Mark. We've actually seen a contrast in different Australian partners. The courts, they really reached out to the Indonesian courts, and they intensified their engagement, and the online actually accelerated a number of changes through exchanges between the courts, which they made public. So there, at different times there were over 500 people participating in or at least observing the exchanges. So the courts really, particularly the family court, but the federal court as well, the two chief justices met really early on and just basically shared information about how they were adapting court services. The family court has been terrific. In contrast, the Australian government security agencies had basically stopped their cooperation because they were very much locked into a modality of, face-to-face workshops in hotels and things like that. And the ones that weren't, like, say, the Ministry of Home Affairs, the old Attorney Generals, have done really well during the pandemic, and in terms of continuing their work and building their relationships to be stronger. But a number of others, they went home, and they didn't really reach back to Indonesia, and so they're going to have to start again. We're trying to help them go online a bit more. But yeah, it's been really noticeable. So we've sort of had to reallocate the funds that would normally go to them to other partners, which has sort of been fine. The other partners have benefited from that.
Great, thanks, Craig. Okay, if there's no other questions, feel free to jump in or put up your hand if there is. But otherwise, we'll move on to the second project presentation, which will be delivered by Jeremy Andrews, who's the Deputy Team Leader and Director of Program Performance on the PNG Economic and Social Infrastructure Program, or ESIP. Over to you, Jeremy.
Thanks, Mark. Let me try and share my screen.
That's looking positive.
Is that working?
Yeah, it's coming, I think. Yep, bingo.
Okay. So I've prepared a presentation. I'll skip through it. I won't speak to all the dot points. So yeah, Deputy Team Leader of the Economic and Social Infrastructure Program in PNG, which is, I guess, a large facility style program that's providing a range of services for DFAT. We're and it's sort of growing to include actual infrastructure construction work now in 2021, following the closure of the TEU program in 2020. So, and we're also providing, mobilising professional consultancies. We've got advisors embedded in the PNG system and state-owned enterprises, so providing, technical assistance. We've also got an emerging and quite interesting area of sort of policy and legislative reform work in the ICT sector. So it's sort of project level work, capacity building work, as well as some more interesting reform work. So a pretty large growing team, 58 in total now, about to kick off another recruitment drive soon for some more positions we need, as the tasking notes keep coming from DFAT. So we're very much a tasking note driven facility, but increasingly we're getting to do some work in this policy space that doesn't necessarily have to sit under tasking notes, which is good, which is what we want to do more of. So sort of just reflecting on our 2020 experience, pandemic hit in March, and as with other programs, internationals flew out of the country. Nationals were told to work from home. We were lucky, as it turned out, that we were relatively well set up to adopt new ways of working at short notice. So we're already on the Ignite cloud-based filing system. Our payroll systems for LES staff were already run from Brisbane. Other projects were doing them in-house. We already had a number of key advisory positions inside PNG government that were being performed by PNG nationals and PNG permanent residents, so they could continue to perform their roles. And we're also, we had a number of consultancies that were underway, being performed by professional consultancy firms in the various sectors that could be performed remotely. So that really was, we were kind of lucky in that sense, particularly those professional consultancies, because a lot of our work, particularly in the energy sector, has long lead times, and there's a lot of kind of initial and analytical feasibility study type work that needs to be done before you get to the point where you're actually delivering projects in the field. So we're lucky that, if the pandemic had struck maybe a year or two later into our project cycle and we were delivering a lot of electrification projects or other types of projects in the field, it might have had more of an impact. But at this stage, just given the stage we are in our project life cycle, a lot of work could continue remotely. As Cardno was going through this process of reflecting on all our activities, implementing the DACI framework, we were also talking, I guess, to our DFAT contacts just about the usefulness of a facility style mechanism in the pandemic context. I mean, I guess we just kept reminding them that we are there to support them. We can be tasked to provide support that doesn't necessarily align with what was in our design document, that it could be outside our sectors of focus. And we can mobilise, get funds out the door pretty quickly to partners to help DFAT with an initial COVID response. And they did task us to form a partnership with WaterAid, where we provided sort of COVID-focused health and hygiene activities in partnership with the Motu Koita Assembly, which are that's the Indigenous people of the Port Moresby area. So we're rolling out health programs and sanitation stations at a number of Motu Koita schools in the Port Moresby area, and this was all happening within about a month of us leaving PNG, or some of us leaving PNG. So we're quickly able to support DFAT in its very early COVID response, just by being a mechanism, a facility style mechanism that can do that sort of thing. So demonstrating our usefulness to DFAT was definitely an early win for us. Moving on to sort of 2021. So at the end of 2020, the former Technical Enabling Unit program, which built stuff, closed, and their personnel and their systems transferred into ESID. And what we've been able to do in close consultation with DFAT is, I guess, pivot some of our social infrastructure work to focus on supporting PNG with its health sector response. So, for example, we set up a COVID-19 testing and triage facility in the grounds of the Port Moresby General Hospital that could be used by the Australian Medical Assistance Team, and that that was just a really practical piece of support to the Port Moresby community. It provided lots of public diplomacy opportunities for DFAT. The High Commissioner was down there, it seemed, every second day, and there's lots of public diplomacy around the AUSMAT team, because it was an important part of Australia's response to the spike in COVID that occurred in PNG in March. But now that we can't take all the credit for the containerised aid post, TEU did a lot of the early work, but ESIT has continued supporting the delivery of containerised aid posts across the country to a number of provinces, 13 provinces, including Bougainville, I think, off the top of my head. And we've also been undertaking some work at the Daru Hospital, implementing some upgrades to the Daru Hospital that were recommended during 2020 by the AUSMAT team, by some representatives of AUSMAT that were in PNG in 2020. And, as Daru is increasingly a province of focus for the Australian government, given it that porous border that exists between Western Province and Northern Australia, and we may well be providing some more support to that hospital, possibly a hospital rebuild. Stand by for more news. So yeah, really, I guess pivoting our social infrastructure construction work to supporting the health response. Now we have a fairly high-profile competitive grants activity called Powering the Community, which provides off-grid electrification. And we're now looking at creating our Powering Community team is now designing what's called Powering Health grants activity, which will fund support the electrification of health facilities in rural and remote parts of PNG. And we're also looking at opportunities to do more community level wash work, following sort of the success of that partnership with WaterAid, and also because we're struggling to partner to undertake some water sector work with Water PNG, just given some challenges partnering with the Water PNG at the moment. So we think that doing more community level wash work could be beneficial for DFAT, and we're developing a paper around the benefits of going down that path. So I guess similar to other programs, we have been looking to sort of reimagine some LTA roles that have previously been performed in country, or people have just assumed need to be performed in country. I think we're more and more during this COVID experience, we've realised that we can perform our roles remotely, and DFAT certainly, our DFAT contacts have certainly been supportive of a number of new positions being performed remotely on a long-term basis, whereas prior to COVID, we probably would have just designated them in-country positions. Mindful that in the next year or two, we're going to be delivering more and more activities in the field. We'll be moving beyond sort of the feasibility preparatory stages. We are sort of quite proactively trying to identify PNG nationals, PNG-based suppliers who can provide services to ESIT. I think that it's just critical that we line up these people and these firms, mindful of the work that's coming. And we're just continuing to crack on with everything else. That one sort of overarching point I'd make is that the tasking notes just kept raining down on us even in 2020. There wasn't a huge sort of program pivot as such during 2020. We just continued cracking on with the work that we'd been tasked with, and DFAT kept on tasking us. So in some senses it was business as usual, but we did, as I've described, look for opportunities to shift focus in certain areas over time, particularly in the social, particularly now that we've got the social infrastructure construction capabilities. I'll probably leave it at that, Mark, in terms of the formal presentation.
Thanks, Jeremy. That's great. Yeah, clearly a lot of similarities, I guess, with AIPJ, just in terms of your ability to respond, linked to being established program, having really strong national team in country, and also just having lots of flexibility, which is pretty clear from the pivot that you've described. I guess just one question before I open it up to others. I mean, you talked about the fact that you're getting to the phase of doing more construction work within ESIP. Are you expecting that to be more difficult if there are significant COVID restrictions, or do you think that's still feasible?
I think if restrictions continue, it will impact sort of project delivery timelines. I think that's sort of the short answer. Depends what the restrictions look like. They can impact our ability to get not just people into the country, but sort of other resources that are required to support a construction project. So yeah, we'll just need to try as much as possible as sort of forecast how these what the impacts might be, and sort of build them into our project timelines, and ensure we're engaging with DFAT on them as early as possible, so there's no surprises.
Yeah. Okay. I've got a few questions here. There's one from Lucia. Lucia, I know you're not shy, and you can ask your own question.
Thanks, Mark. Thanks, Jez. That was really useful. Just wondering, with all these new areas of programming that you're going into with WASH and health infrastructure, whether it's been challenging to source the right expertise, especially in the COVID context, and how you've gone, what strategies you've used to find the right people.
Thanks, Lucia. Well, I mean, luckily, certainly on the WASH side, we partnered with a local, with an international NGO, but which had a local team. So I think certainly partnering with organisations that already have people in country is probably one approach, which has worked quite well for us on the WASH side. And I think that's another reason why we might try to do some more community work, because we'd be partnering with organisations that already have people in country. This is our competitive grants program, the Power and Community Grants program, which is our main mechanism for rolling out off-grid electrification. That would be, we'd be partnering with organisations that already have teams in country, and that all forms part of their proposal to us. So I'm not sure if that's sort of a partial answer. I mean, I'd also just say, I mean, we've got a number of unfilled positions on ESIP, and it is an ongoing challenge. Filling the slots, particularly positions that do need to be performed in country. In the current environment, I think there's longer lead times, and then it takes longer to deploy people. So it is an ongoing challenge that we haven't necessarily found the solution to yet. It is, I guess it's just being upfront and honest about DFAT is part of the solution, is just letting them know that projects, particularly projects that require real technical expertise that can't necessarily be sourced in country, timelines will be impacted, and just being upfront and honest and trying to build that into your project plans is critical.
I've got a question here from Ibu Yulia from Catalyst. Did you want to ask your own question, Ibu, or would you like me to repeat it? I think you're on mute. Well, I'm happy to ask the question. Ibu Yulia's wanted to know if there are any programs that are not, I guess, not just about adaptation to COVID, but actually working on direct mitigation efforts for the possible longer term impact of the current pandemic. So I guess it's a question around, are they directly addressing COVID and the future issues associated with COVID? Is that right? Yeah. Okay. So I guess I mean, Jeremy, feel free to respond, but I guess it's a broader question for Cardno as well across the portfolio. And I don't know whether any of the country managers, Joe and others, who, if you can think across your portfolio, a brief summary of any projects that are more directly addressing this than others.
I'm trying to think through all our tasking notes at the same time.
I guess the ones that come to mind are the health programs that are looking at those health system strengthening and pandemic response preparedness kind of work. They're the ones that come to mind.
I mean,
health security initiative and Vanuatu health program.
Which is probably not the space that we're in. We're sort of building, possibly building the hospital, but obviously that the systems that are also that operate within the hospital are critical, and we'll have limited control over that. We'll do the build, but that's only part of the solution.
Yep, but certainly some of our other infrastructure programs, including in the Solomon Islands, have been tasked to provide health infrastructure at fairly short notice as well. Okay. Craig, did you have your hand up?
I think he's frozen on my screen.
I think he's frozen on my screen too.
Yeah.
All right. Well,
Okay.
I'll come back.
Yeah.
Oh, there he is.
I'm
Sorry,
back.
go on, Craig. Yep, you're back.
Yeah. Okay. No, just the point that Jeremy made about a facility being able to sort of jump into gaps. I think that's something we've noticed as well, particularly the ending of certain programs and the starting of others has sort of happened during this time, and they've really found it difficult to get moving. So, I think, being able to stretch yourself a little bit outside of your normal scope and jumping into certain areas, I think is really, really important. And I think, a number of programs that I've sort of observed have done that really, really well. The relationships obviously help too, because you can use existing relationships to actually engage on topics that previously belonged in a different program. So that helps enormously as well.
Great. Thanks, Craig. All right, we'll keep moving. I'll shortly hand over to Induni Senarath, who is a project manager responsible for the Nauru Sustainable and Climate Resilient Connectivity Project. Probably not everyone on this call is aware. I think you know that Cardno is globally an engineering consulting company with a very significant international development arm from which where we all sit. But within the Asia Pacific International Development Team, we also have our own infrastructure project management and consulting part part of the business, the physical infrastructure business. So that's where Induni's from, that business unit. And so, yeah, perhaps give a perspective on a different type of project. Over to you, Induni.
Thanks, Mark. I'll just share my screen. Can you see my screen?
Yep.
Perfect. So thanks, Mark. I'll start off with a bit of a project overview for those who aren't aware of the Nauru project, how COVID affected the project and how we overcame the challenges caused by the pandemic. So for those who don't know the project, we focus on the Iwo Harbour, which is located on the western side of Nauru. 95% of its imports and exports are through this harbour. So that's food, daily necessities, medical and school supplies, as well as fuel, which the island requires for its transport, water and electricity. So the issue with the existing facilities is that it is dependent on a mooring system because it lacks a wharf where a ship can berth right against a wharf and transfer containers. So as you can see, it is a quite a small harbour over here, and some of the operations pose significant health and safety risks. So I will move on to the next few slides in a second to show you a few of those operations. This is just an aerial view of the existing harbour, and what happens is container ships, usually more offshore, and this is a photo of a container ship. Pusher barges travel towards the container ship, and one by one the containers get loaded onto this pusher barge. Then it goes into the small harbour, then gets offloaded by a crane onto the container yard. So this process during bad weather could take up to weeks compared to something that should only take a few days. So that's just a few of the photos of the process, and the reverse of the operations happen where empty containers get loaded onto these barges and get loaded back onto the container ship. So as you can see, some HSE risks on some of the operations that occur. And the existing buildings, warehouse, the harbour master's office, they were in a derelict condition and they required rebuilding. So Cardno, under a separate contract, was engaged to design new port facilities. So this is an artist impression of the proposed international port. So this is the existing harbour over here that you saw in the previous photos. There's a separate container yard. There's a wharf here where, as you can see, a container ship can berth right onto it. There's a berth pocket dredged into the shallow reef. New warehouse and office buildings, and also a new reverse osmosis pump facility, which would supply water to the entire island. So just a few details around Cardno's construction supervision consultancy. So the funding is by Asian Development Bank, Green Climate Fund, Australian Government and Government of Nauru. It's a $64 million civil works contract. The contractor is China Harbour Engineering Company, shortly known as CHEC. Time for completion was 721 days, and the contract was signed late in 2018. So Cardno's scope of works is basically supervising the construction. So usual contract administration processes, making sure the quality assurance and quality control works are in place, as well as safeguards, making sure that the project implementation follows all the safeguards activities as well. I won't go through all the points, but it is there. I can share the slides if anyone is interested. So a bit around how COVID affected the project. So the contractor was delayed in implementing their construction program because the government of Nauru imposed travel restrictions on the contractor bringing in human resources from China. So this resulted in a shortage of skilled laborers, which they required in order to continue with the construction activities. And also the pandemic caused restrictions resulted in plant and material not getting delivered to the site on time as well. The government of Nauru also stopped all their flights except for just one flight in and out of the country every fortnight, and that was through Brisbane only. And eventually, as you all know, Australian international borders also closed, which is where the only point of entry into Nauru via commercial airline was. So basically, due to all these factors, the engineer, who is Cardno in this case, received claims from the contractor, which related to program progress, issues caused by the pandemic. And because the duration of these issues, we weren't sure how long this pandemic would last for. So we couldn't identify how long the delay would be for the program. So what the engineer, the employer and contractor came up with was to agree to something that would mutually benefit both parties, being the contractor and the employer. So it was a suspension agreement that was signed between the two parties where the contractor would suspend permanent works because they couldn't bring in materials or mobilize workforce as they needed. But for them to use the existing labor on the ground to continue with temporary and preparatory works, so that the contractor could actually catch up with their program. Time wouldn't be considered as ongoing, it would be considered as on hold while the contractor caught up with their program. The employer would only have to pay the contractor for idling costs, and the employer therefore wouldn't be entitled to any delayed damages. Another item that was under the suspension agreement was that the contractor would withdraw all of its previous claims that related to extension of time requests. Basically, the agreement was put in place so that it benefited both parties. And it reduced the exposure for the employer as well in relation to global restrictions. So in relation to the supervision services that Cardno provided, 3 of our supervision team members remained on ground, and that allowed us to retain a presence in the country and continue providing construction supervision services. They preferred to remain on the ground because Nauru was a low risk of exposure to COVID. To date, there aren't any cases in the country. Remotely, we had our team leader continuing his leadership from Brisbane, and then we had safeguards specialist input still continuing remotely from 3 different countries. It obviously had more Teams meetings and calls just so that they could continue on that work. So the suspension agreement ended this year in April, when the contractor was able to mobilize 96 personnel on a charter flight from China to Nauru. And in preparation for these activities, we did also have to mobilize additional supervision to the ground. So we mobilized our team leader, who's based in Brisbane. We had to recruit a work supervisor from Fiji and get her on a charter flight. We also recruited and mobilized a work supervisor from Solomon Islands. Ryan was able to convince Nauru Airlines to stop over and pick up a work supervisor from Honiara. Not sure how he managed to do that. We temporarily mobilized a team member from the Ports and Maritime team as well. And we have a materials and QA engineer en route to Nauru, actually. He's mobilizing from the US. And we are actually currently recruiting a few more positions. And I just thought I would share some progress photos of the site as well. That's the existing harbour and outlines of the wharf over here that is under construction. This is the berth pocket, which has some reclamation on there at the moment. That's a zoomed in photo. And just another view. And I think that's it.
Thanks, Induni. That's great. I'm sure there are a lot of people out there like me who have no background or understanding of this, and I find it really fascinating. I did notice your artistic impression of the port, which, it looks so amazing. I feel like you would always risk not being able to actually deliver on your artistic impression. Is that true?
Yeah, it does look amazing, and I guess it is really good to see how the project is coming together. We do receive drone photos and videos. I think the team on site is doing a really good job. So if they keep it up, I think we can deliver. Yeah.
Yeah, it reminds me a little bit about like some of the proposals I've written recently. Okay, got a few questions. Jeremy?
Thanks, Mark. I had heard about Ryan Agnew's success in convincing, was it Nauru Air to land in Honiara? Can you tell us a bit more about that? I think that's one of the best stories I've heard all year. Talk about adaptive thinking. And
did he convince them while they were in mid-flight, or?
No. It surprisingly didn't take too long. It was Nauru Airlines. We just had our project support officer, Andy. She was liaising. Alison's comment. She was liaising with Nauru Airlines, and we had a contact through there. We explained the situation. We asked the question. Ryan asked how much it was, and it just sort of took off from there. They agreed. It was pretty straightforward and easy, to be honest. We gave the heads up to ADB as well. Everyone was happy.
And in Dooney, this mutual suspension agreement that you put in place, I mean, is this was that a fairly common arrangement for infrastructure projects during all the challenges of the last 12 months, or was it fairly unique being able to negotiate on this project?
So as I understand, it is a fairly unique agreement to put in place. The team leader on the project somehow managed to put this together with the employer and contractor. As far as I understand, I'm not aware of other projects that have done it. I see Dick Kells on the line, and maybe he might be aware of any other projects. I'm not sure, Dick.
Well, thank you, Induni. And I might start, Mark, with paying a significant compliment to Induni and Ryan and the team for keeping this project moving. It is, in fact, a very key project in the thinking of the ADB, and they were most reluctant to recognise that that COVID could have anything to do with progress on the site, and so Induni and Ryan and our team, with Alison's help, have had to manage the ADB as well, and that's all worked out well at the moment. And I would also say that this is an indication of where supervision on sites can become difficult if the projects have a high degree of engineering complexity. And this project has got bored piles in the key walls, which really need specialist inspection, both on the part of the contractor and the supervisors. And we did look at various means of doing this from off-site, perhaps using drones or some other means, and that didn't prove feasible. There wasn't anything available that would replace the actual physical inspection. I mean, you can use cameras down the pier hole. So it was, overall a challenging project. It's about, I didn't pick up, but it's about a 90 million US contract. It's not a small contract, and I think the work has been done well. Suspension is permitted under a FIDIC contract. So this is a FIDIC MDB or Multilateral Development Bank contract, and we included well, we didn't know that COVID was coming up, but in writing the contract documents, we included the FIDIC suspension possibility for suspension in the contract, and that's what our team leader was applying. So it's not usual to have to do that, but it is possible under a FIDIC contract, and that we should recognise that. So again, full credit. The project is proceeding, and to good quality, and full credit to Induni and Ryan and the team, our team. I'll stop there.
Thanks, Dick. Okay, all right. Well, thanks very much for that, Induni. It's great. And move to the last but not least project, the long-standing ASEAN Australia Counter-Trafficking Program. Long-standing program, newly appointed team leader, Lucia. Over to you.
Thanks, Mark. Yes, I am the short-standing justice team leader on this call, and it's really lovely to see so many friends and colleagues on this call and to learn from such a diversity of projects as well. So I'm just going to ask Aaron, our deputy team leader, to share his screen. I think it's important that you hear from the people that actually implemented during COVID, so I'm not going to talk for very long today. Just briefly to introduce my team, my deputy team leader, Aaron. We've also got Kem, who is our ASEAN Regional Director and was our country Philippines manager during COVID. We've got Han dialing in from Vietnam, who is our Vietnam country manager. And we have Mbat Nurul, who's our Equality and Inclusion and Victim Rights Director. So just briefly, for those of you that are not familiar with ASEAN Act, the Counter-Trafficking Program. Next slide, thanks, Aaron. A really quick overview. So ASEAN Act works and engages with all 10 ASEAN member states, but it's got targeted programming in Cambodia, the Philippines, Indonesia, Thailand, Vietnam, Laos, PDR and Myanmar, which is unfortunately on hold. It is quite programmatic, so unlike some of these facilities that we've heard from earlier today, ASEAN Act is quite squarely focused around implementing the ASEAN Convention against countering trafficking, especially women and girls. So we have 3 interrelated end of program outcomes and pathways. The first is to build capacity at the regional level, at the ASEAN level, to implement the convention. The second is to work with individuals, organisations and on the broader enabling environment for national capacity, with a particular focus on victim rights and inclusion. And our third pathway, the newest of our pathways, is really about broadening the range of voices that are participating in the policy process around counter-trafficking policies and legislation. So that includes working with civil society and brokering dialogue between the private sector and government. Next slide, please. So the first thing we did when COVID hit was, of course, to reassess our development problem. We conducted a COVID situational analysis that firstly debunked a number of myths or assumptions. One of those was that trafficking would actually stop once borders were closed. Another assumption was that countering trafficking responses would have to stop because frontline offenders or officers were facing all sorts of threats. In fact, both of those, it turned out to be the opposite. So we have seen that COVID-19 has exacerbated existing vulnerabilities to trafficking, particularly among women and children, among irregular migrants, among those working in the informal sector. And of course, COVID has created new vulnerabilities to trafficking, particularly those that have become unemployed as a result of COVID, and particularly because the demand for forced and cheap labour has increased in Southeast Asia with economic downturn. The study also found that victims of trafficking are particularly vulnerable to contracting the virus. They have limited access to information and health services, and a lot of the critical service providers that support victims had to stop their operations or severely restrict their operations during COVID. We also found that trafficking were changing and still are changing their modus operandi, so increasingly moving to online recruitment and more sophisticated ways of avoiding the closure of borders. And with that, the identification and protection of victims of trafficking has become much more complicated, and the prosecution of trafficking, which involves a criminal case, has also become extremely constrained and difficult during COVID. And importantly for us, a lot of resources, a lot of budget, and a lot of the attention of the law enforcement partners that we work with has been devoted to the COVID response. So essentially what this means for us in a nutshell, next slide, thank you, Aaron, is that the vulnerability to trafficking and the vulnerability of those who are trafficked in Southeast Asia is increasing. Budgets, human resources, and the capacity of law enforcement officers and related agencies to address trafficking is decreasing. So effectively, this meant for our project, we needed to support our partners to do more with less. Over to you, Kem, for the Philippines experience.
Thank you, Lucia. ASEAN Act Philippines adopted a threefold interconnected approach to deal with the disruption. First, we shifted our implementation delivery from fully in-person and in-venue to fully virtual or sometimes blended delivery. We designed activities either synchronous or asynchronous, mindful of the need for some of our counterparts to work at their own pace. Second, we responded and adapted to the fast-changing context around the program, responding to the many changes in our counterparts in the justice sector and operating environment. In our partner agencies, priorities and focal persons have shifted, so we continue to advocate to sustain the counter-trafficking work despite COVID. To ensure business continuity, we maintain strong relationships so we don't appear to be transactional and maintain that place of trust. Third, within the ASEAN Act team, we innovated our internal admin and logistics processes, enabling us to respond to the novel and different situation. New rules were crafted on what could be supported and how. To illustrate, allow me to share some practical steps taken to implement an 8-day workshop with the Department of the Interior and Local Government of the Philippines, where we have a project. First, we communicated and planned early to strategize our approach. We suffered multiple postponements, but in our planning, we identified the risks involved. This could be around the current lockdown protocols, movement limitations, risks around the health and safety of our counterparts from the justice sector, and safety of our team members. Given the risks, we identified COVID testing sites. Sometimes we required COVID testing prior to the activity. So far, none have tested positive. To help lessen the risk of infections among participants, masks were required. And in another activity, we delivered meals to individual rooms to avoid congregation during lunch breaks. We identified two risks around quality and effectiveness of the activity, which could involve participation through, which could involve the matter of the internet connectivity and availability of speakers and participants. We incentivized participation through our support and quality of our activity. We supported their connectivity needs and meals, whether they were working from home or from their offices or venue, to ensure they could fully participate. We made a decision to deliver the activity blended, both in person with limited number of participants and virtual via Zoom. If they could not come to a venue, the venue came to them, so to speak. So we mailed the participant kits, which contained headsets, workshop documents, and PPEs with sanitizers, and we had to be creative. We had a lot of icebreakers, breakout groups, online games and tools. We gave participants homeworks. We finished the day earlier than usual and always provided participants with a breathing space. There were a lot of, "How are you doing today?" We decided to use a suitable venue for some participants. Those which are not suitable venues are those which are not used as COVID-19 quarantine facilities. But again, participants had a choice to join online, from home, from their offices, or from an accommodation which we arranged for them. Some participants chose to stay in a safe hotel in their localities. They were captured audience. Finally, this activity was safely and successfully delivered, and it gained positive feedback from the participants. And this is the ASEAN Act Philippines experience, a narrative of adapting to the new operating environment. Now I turn over to my colleague Han to share the Vietnam story.
Thank you, Cam, and good afternoon, everyone. We would like to share with you some experience that the ASEAN Act program in Vietnam have been implementing in order to continue our business in Vietnam. So for business continuity, we apply 4 keys, letter C. They are communications, connectivity, creativity, collaboration or cooperation in maintaining the activities in Vietnam. So for communication, we keep the communication within the team, with the regional technical team, and also with the counterpart. So in keeping the external and internal communication flow smoothly, we were able to foster better understanding, agreement for people involved to seek and work in the same direction and objective. For the second letter C, connectivity, since most of our staff and majority of the counterpart officer have been working from home. So we need to stay connected so that they see themselves still as a part of a team and a program, and that operation and implementation are still going on. So we keep connection through different communication channels, such as group chat, phone call, email, and we have regular team meeting, both in Vietnam and also with the regional team. And we keep calling the counterparts sometime just to check in, like Cam just shared, and also to have meeting with them virtually. In order to not to just stay and wait, because Vietnam has experienced the 4th outbreak of COVID since early last year. So over the last 1.5 years, we have experienced the 4th outbreak already. And in between, the operation have been still allowed to be on with some restriction. So we have to be very creative in design and delivery of our program activities. So in order to support the counterpart to join the activities within the travel restriction and social distancing, we provide them the training on using online platform in order to maintain the communication, and also support them to join the event which have been organized online. And because our activity need a lot of technical support from the regional team, so we combine online with offline type of event. And also, since we have a number of events and some topic similar between the regional and national level, so we combine the event with one topic, so to reduce the number of events organized. And also sometimes the government have restriction on allowing only less than 20 people for gathering. So instead of having very big event, we organize smaller event. So we still able to organize the meeting in person. And in between, when we have social distancing, we have prepare for the activity such as proofreading of the material, contact the speaker or trainer to prepare for the presentation, have a list of invitee ready, and all other logistic and administration prepare. So when the restriction are eased, we can immediately start the activities. And when one counterpart they cannot conduct the activity as per schedule, we switch to other counterpart to have another activity. I would like to share with you one example. This week, we are having now today one training for the lawyer and legal aid officer. And actually, this schedule was served for the Ministry of Public Security. But because the force has been mobilized to support with the control of the virus, so we switch to other partner to organize the event. So we don't have to wait a lot of time waiting for the counterpart, because otherwise the activity will be gathered a lot by the end of the year and we cannot complete the activities. And the last C, which is also very important that we would like to share with you, is to enhance collaboration and cooperation within the team and also with the counterpart. So when we have any event, we inform the related staff and party involved about the objective, the agenda, participant venue, type of delivery. And we have standard checklists for each of the activities to share with every stakeholder involved. And we keep communicate with the counterpart about what kind of support we will need from them. And we did the same with the technical directors. So in summary, by applying these four aspects, communication, connectivity, creativity, and collaboration, we have been able to implement the activity amid COVID-19 in Vietnam. Thank you for your listening, and I would like to pass the floor to my colleague, Nur.
Thank you, Han. Hello here from Indonesia. I will continue the presentation by sharing few slides on how we continue to prioritize gender equality and social inclusion, or in short, we say JESI, as well as on victim rights, as in short, we say VR during the pandemic. As directed by each end of program outcomes or EOPO, we aim to continue mainstreaming or placing JESI and VR under each project activity's objective. As an example, under Pathway 1, ASEAN Act continue to facilitate learning sharing among ASEAN member states or AMS on the issues related to JESI and VR. Among others, we have been hosting webinar series on adaptive justice response to trafficking in person or TIP, with focus issues on VR and JESI being discussed. Also drawing on ASEAN Act study on shelter practices for victims of trafficking across ASEAN member states, ASEAN Act facilitate regional workshop, all done also virtually, on knowledge exchange and experience sharing on shelter practices among ASEAN member states to promote freedom of movement and non-detention of trafficking in person victims. We are very pleased actually that the recent published US TIP report for 2021 has echoed the findings by included the recommendation to some ASEAN member states to consider promoting freedom of movement and non-detention during the provision of shelters. Next slide, please. Under Pathway 2, ASEAN Act continued to influence national government to mainstreaming JESI and VR and alignment with the ASEAN Convention on Trafficking into their national policies on TIP. So far, all also done virtually or combined in a hybrid method that Hans and Cam has explained to you. Sharing with you some progress on this work, the program has successfully influenced Vietnam counterpart to mainstreaming JESI and VR into their new 5 years NPA or National Plan of Action 2021 to 2025. A strong focus on VR and GSC were incorporated. Among others, the NPA placed the identification, rescue, protection, and support of victims as a primary objective of the plan, and acknowledged that this is of equal importance to trafficking convictions and punishment of offenders. Importantly, the plan also acknowledged current gaps in data collection, including the lack of gender and diversity disaggregated data, and commit all stakeholders to systemize data collections and respond to this diversity disaggregated data. Next slide, please. Under Pathway 3, ASEAN Act continued to support civil society partners to engage more into policy dialogue between justice and non-justice agency on issues related to GSC and VR. The end goal of this project is to support multi-sectoral response to counter trafficking by engaging wider social group to fulfill the diverse needs of the victim. During the beginning of the pandemic, ASEAN Act has also managed to conduct a VR and GSC stakeholder mapping exercise to identify potential partners from both government and non-government agencies, as well as forward-thinking businesses, institutional and individual who could be, support effective, right-based and inclusion approach that we have currently initiating. From the mapping exercise, we have also published under our portal and website the stakeholder directory in case you wish to know more. There are a lot more works that I wish to share with you under each pathway, but unfortunately with limited time, I cannot do so. Happy to respond during Q&A, and now I am pleased to hand it over to TTL Aaron to continue the presentation. Thank you.
Thank you very much, Nurul. I'll run through the next couple slides quickly because I know we're getting over on time a bit here. Just quickly for us, for our operations and support to our implementation, we took some steps to ensure that our ways of working were not interrupted too severely due to the changes in our multiple operating environments. Currently, we've got programming in 5 countries. In late March last year, our directors based in Thailand were relocated to their home bases, and all our country teams transitioned to work from home arrangements. But due to having Microsoft Teams as our core internal communications platform, the team was able to make the transition very quickly. So to remain connected, we started to do small online things like posting good morning messages, letting people know when we were going on breaks, and also signing off for the day. We also made sure we had regular team meetings to update each other on the changing situations on the ground, and regular consultation meetings with our counterparts, as Kem and Han had mentioned, to ready ourselves for any changes in delivery that we're going to need to make in response to the pandemic. Very quickly, I'll just show you our Microsoft Teams setup. We've got different teams with different channels for our country teams, our technical teams, support from Cardno, and we post anything in through there. So effectively, we don't use email anymore. Topics are put up, documents are attached, people reply. You can see there we've got 107 replies on that particular post. Saves a lot of room in the inbox. And we also have the chat function where people in different groups can chat on different topics that we need to cover. So with Teams being our core platform for comms and knowledge sharing internally, we then looked at moving a bit deeper into the virtual environment by implementing Zoom in mid-2020 for all our external meetings, and we deployed that across all our teams so they had a tool to continue implementation in those countries that were into lockdown early. Others, like in Vietnam, were able to continue with face-to-face, but as Hans mentioned, they now are in lockdowns off and on, so they were able to attend our regional events, and the teams were familiar with Zoom, so they could deploy it quickly when the situation changed in a particular country. With our budgeting, having all those multiple work plans made forecasting extremely difficult. So with myself and the operations team, we use bottom-up budgeting on a monthly basis and consolidated that to give DFAT some best we could accurate forecasts, and it also helped us identify any significant changes which we could communicate to them early and provide a rationale for them so that could be communicated through to Canberra. For our planning, last April we issued an addendum to our 2020 work plan, which we then followed up with a revision mid-year, and that was based on a framework of mitigation steps that we were taking for continuity of the program during COVID-19. Lucia mentioned the situational analysis that we conducted in detail mid last year as well. Just quickly, we also did some strategic comms work to reset our message and provide DFAT with a pathway out of COVID-19 with a emergency, late emergency, and then recovery phase response, which we built the annual plan revision and current 2021 annual plan around. Early on, we reiterated the program's goal and how it remained relevant to them and developed a blog post on the Dev Policy blog and also followed that blog up with a detailed paper. We then developed a partnerships hub that we used to reaffirm our commitment to counterparts. Country teams were in contact early with them in 2020 to reaffirm our support for them, and were able to answer any questions they might have or provide support that they needed. And then we've developed a series of webinars to try and share information on the different types of trafficking responses, adapting to the new normal, and particular topics that are relevant to our counterparts so that they could share knowledge across the region. And with that, I'll hand back to Lucia.
Thanks, Aaron. I know we're over time, so I might just leave this slide up, but these are a couple of things that I think we'll continue to do when COVID's over and it just feels like it was all a bit of a bad dream, particularly supporting innovation and technology across the justice sector. Craig mentioned e-courts in Indonesia, but they're also really moving towards that in Thailand and other countries as well. And just drawing your attention with visual to the hybrid training models, which are working really well. We did one this morning from Vietnam. This is another example from Vietnam. And just finally, because of adaptation was sort of a theme throughout this presentation, that those quicker, tighter feedback loops are really important during this period to work out whether what we're doing is working and to make adjustments as necessary. So I'll leave it there. Thank you.
Thanks so much, Lucia and team. That was really wonderful. It's not, I want to note that it's not a competition, but if it was a competition, you would win the flashiest PowerPoint presentation award for sure. There's obviously a lot to unpack in that presentation. Really, I mean, I guess the additional challenges of a regional program where different activities, different COVID situations in each of the countries that you're working with, it sounds really, yeah, a major challenge, and it's wonderful to hear all the different ideas and initiatives that your team have put forward. I'm conscious we're running out of time, and I know people want to drift off at the half hour. Are there any quick questions before we wrap up for the ASEAN ACT team? Pon Lu, sorry if I've got your name wrong. Had your hand up for a while?
Yes, thank you, Mark. My name is Pon Lu. I'm from Cambodia. I'm working in Cambodia-Australia Agricultural Value Chain Program called CAVAC. Thank you for sharing all the useful information. I would like to have a quick question regarding with the COVID testing before activity, which was presented by colleague from the Philippines, I believe. Could you elaborate more? Because I think it's a good point, and also because now Cambodian government just imported the rapid COVID test tool, which I think can provide more confidence to our staff and also our counterpart, like doing the test before joining the activity. Could you elaborate that more, please? Thank you.
Hi, Pondo. Yeah, sure. Firstly, we identify the COVID testing sites close to our venue, but this is only required for persons who are going to a venue. For persons working from home and from their offices, they will not be required to take the tests. But for persons going to our in-person venues, they would be required to take tests in a specific testing site that is very close to that venue. And only when they test negative would they be allowed to join the bigger group. Luckily, there had not been any positive results, but if there were, we are aware of the COVID-19 protocols for each local government unit where we operate, and then we will follow that protocol, contacting the authorities and then local government units to handle that case. So it's all pre-arranged, and the participants early on know where to go, and these things are communicated to them early so that they are aware of the steps that should be taken for that COVID testing.
Just a quick follow-up. Are there a lot of activities that you do like in person like that to do in order to do the testing, or just one or two? Yeah.
Well, at first we were afraid to do in-person activities, and because we had to grapple with the new situation. But given that we figured that the risks were going down already, in particularly in the Philippines. But if the risks go up, we do not conduct in-person and in-venue activity. We conduct activities fully online. But if we do decide that the risks are low for COVID infections, then we do the in-person and in-venue activities. That's why we decided on COVID testing. But now our conversations now go around to conducting activities with participants who are fully vaccinated, and some of the staff are already vaccinated, and many of our counterparts are also fully vaccinated. So we're now conversing around that area.
Thank you. And Kerry, quick question.
Yeah, hi. It probably applies to the other programs. You know, we've talked about perhaps increased participation with the online platforms, but I just wonder how it's impacted upon, you know, those networks and those relationships that are established through the sort of water cooler conversations, you know, whilst you're getting a cup of tea from wanting tea or something like that, particularly in something like a regional program, you know, that seems to be pretty key to me. So I just wonder if there is or if it's felt the loss of the water cooler conversation.
Thanks, Kerry. Maybe I'll make a quick observation being a new user to the team system that Aaron showed you. At the moment, no, I actually feel that the platform has been a bit of an equalizer, and it has a much more flatter way of communicating. When you use Teams, things go to everybody and it's less hierarchical. It's also a very informal style of communication. So I think whilst a junior staff member might not take the effort to write to the deputy team leader, they would very easily shoot them a message on Teams to clarify something. That's one thing. And I think, you know, I think we feel that we need to invest in our relationships more heavily, and we need to be more creative in the way that we keep relations with our counterparts. But as Han was saying, regular phone calls, regular check-ins, probably a lot more regularly, because it's not going to happen by accident. It's not going to happen incidentally. So I think it's kind of made us a lot more deliberate about our communications as well. I'm not sure if anyone else in the team would like to add to that.
Cam or Nurul, Han, any comments?
To add a little bit, so far, I think the partners is also considering of reaching to us as well, because they understood that they cannot be meeting in person, doing morning, morning coffee or whatever. So the communication through digital electronic, like, WhatsApp or even emails, and also Zoom, it has been done. For example, under the ASEAN program, we managed to even expand, establish a new partnership with the other ASEAN sectoral body, which is include ACWC and ICHAR, the ASEAN Intergovernmental Commissions on Human Rights. So this, because the sectoral body itself also considering it is very important to continue moving forward while the pandemic is happening. So the mutual kind of, interest is there as well. So that is also considered to be supporting the process. Yeah. And also for Cambodia, if I might add, it is very interesting news because our country managers now also get the very good information that the government agreed to do a virtual meeting, or training or whatever activities, which before they don't. So this is actually also an interesting development. They like it or not, they must have to do something, and then they have to make use of the technology. That's it. Thank you.
Okay. Thank you so much. Conscious we've just come up to time. I'm sure that many people have got follow-up questions or things that they would like to follow up with the presenters. I guess I'd really encourage you to reach out to the respective projects. I guess I'm offering on behalf of all the presenters. I'm sure they're happy to field your questions. If you want to share the presentations shared, I'm more than happy to facilitate any introductions or requests as well. Certainly one of the purposes of these sessions. Thanks so much to all of the presenters today. Thanks also for everyone attending. I'm conscious that nearly 150 people for an hour and a half, it's a really big investment of time. So I really hope that people enjoyed it and got something out of it. Please feel free to give any feedback. We do have some ideas about future topics for future sessions, but we're really keen for them to be of maximum interest and relevance to as many people as possible. So please feel free to reach out with ideas or suggestions about what we can cover in future sessions. Okay, thanks very much for your time, everyone. We'll be in touch.
Thank you.
Thank you.
Thanks, Mark.
Thanks, Mark.
Thank you.
Thanks.
Thank
Thank you.
Bye all.
Thank you.
Bye. Thank you, everyone.